Hello, I'm Dr. Fiona. Premature babies are babies born less than 37 weeks of pregnancy. If the babies are born too early, their bodies are not fully formed. This will cause a lot of problems such as heart, lung, brain, and even eye problems. Retinopathy of prematurity, or ROP, is a potentially blinding eye disease which affects premature babies. Babies with ROP may develop short-sightedness, squint, lazy eye, glaucoma, retinal detachment, and even blindness. This is the retina. The retina is an extension of the brain and forms the nerve layer of the eye. It helps capture light and convert it into electrical signals so that the person can see. The retina develops in the mother's womb, and it requires a minimum of 36 weeks to develop normally. In premature babies, the retina has to develop outside the womb, and this may lead to abnormal retinal development. ROP is classified into zones and stages. The zones tell us where the disease is, and the stages tell us how bad or how severe the ROP is. Let's talk about the zones. There are 3 zones. The retina will start growing outwards from the optic disc in zone 1 to gradually reach zone 3. Once the retina reaches the end of zone 3, it is considered normal, mature retina. So, the more developed the retina is, the higher the zone and the better prognosis for baby. For stages, there are 5 stages. For stages 1 and 2, the retina stops growing and forms a border separating normal retina from abnormal retina. Stages 1 and 2 require careful observation and have a good chance of resolving without treatment. For stage 3, the blood vessels of the retina grow upwards and start pooling on the normal retina. If the pooling is severe, ROP will progress to stage 4 or stage 5 where there is partial or total retinal detachment. For stage 3 and above, treatment is required. Premature babies who have the highest risk of ROP are babies born at 32 weeks or earlier, have a birth weight of 1.5 kilograms or less, or have a history of prolonged oxygen use, anemia, or are generally unwell at birth. During the examination, special eye drops will be used to dilate the pupil. The eye doctor will use a small metal speculum to open the baby's eyes and examine the baby's eyes using a special microscope and lens. ROP eye screening will be done regularly according to a fixed schedule. If everything is normal, the baby will have the last eye screening at 40 weeks of age. Should the baby require treatment for ROP, the type of treatment will depend on the severity of ROP. Treatment options may include laser, special injections, or even surgery to repair the retina. If your baby is born premature, it is very important that the baby goes for an eye checkup, as ROP can happen anytime in immature retina. Lastly, do not let your baby watch digital devices such as phones, tablets, computers, or the television, especially if they're aged 3 years and below, as ROP will increase the risk of short-sightedness and squint. This concludes our video for today, and if you've enjoyed it, please remember to like, share, and press the notification bell so that you don't miss my next video. Thank you!